Okay, welcome councillors and officers from North Devon Council, our panel members and members of the public for the special meeting of the Policy Development Committee to discuss health inequalities and GP surgeries within the North Devon area. Can I please remind everybody to switch their mobile phones to silent? I do apologise about the length of my briefing notes, but we'll get there. Can we ask that those attending virtually switch off your microphone to avoid any distraction during the meeting? The meeting is being recorded and will be available in due course on the North Devon Council YouTube channel. Please be aware that the purpose of this meeting is part of a fact-finding exercise to enable councillors and members of the public to be fully aware of the current situation regarding health inequalities, together with the provision of access to GP surgeries across North Devon as a whole. We would therefore politely request that anyone who addresses the committee or panelists to avoid making any political statements, to only ask direct questions, and that we keep to the schedule detailing the front pages of the agenda. Reminder for councillors to ensure that those attending virtually can hear the proceedings and for the recording to capture the entire meeting. Please ensure that you project your voice and speak clearly. To assist you, we have microphones which have been placed in strategic positions around the room. And we also have an officer, Glyn, over there, with a roaming microphone, which will be powerful when you are invited to address the panelists. Please remember it's a formal meeting and therefore do not refer to each other by first names. Members of the public, we are pleased to welcome members of the public to this special meeting. As stated on the front pages of the agenda, at approximately 7:40, both chairs, that's myself and Sarah, Councillor Wilson, sorry, will suspend their standing orders. We will suspend our standing orders to give you the opportunity for the invite to ask questions. The committee will then reconvene at approximately 8:20 to consider actions and next steps. If you wish to ask a question at the point where we suspend the standing orders, you will have the opportunity to ask questions and must indicate your wish to speak by raising your hand. We will then invite you to stand. You will be given the opportunity to present your question to the panelists. Same rules for you as the councillors. Please no political statements and keep your questions short and succinct. As for councillors, we have a roaming microphone which, for the purpose of both recording and all attendees being able to hear the proceedings, we would politely request that you use. Given that there are likely to be a number of members of the public who wish to ask questions, and with the limited time available, please ensure that you ask a question and refrain from making additional comments. We will do all our best to get through as many of the public questions as we can within the time available this evening. To ensure that this is possible, your cooperation will be very much appreciated. If, however, we do not manage to ask all the questions arising, we will make sure that they are submitted to the panel after the meeting and the response will be sent to your email address, which we would ask that you provide to us at the close of the meeting. The timings of the meeting have been arranged to ensure that the committee members and the public have an equal and fair opportunity to address the panelists. Please remember this is a formal committee meeting and it's important that respect is shown to the chair, of course, the committee members and the invited panelists, officers and each other at all times. Anyone who does not respect these rules or behaves in an offensive or inappropriate manner will be asked to leave the meeting. So there we are, that's the end of my announcements. So I'll formally open the meeting. So Kelly, have we got any apologies?
Thank you, Chair. I have apologies from Councillors Peter Lever and Councillor Spear.
Thank you. Item 2 is items brought forward which, in the opinion of the Chair, should be considered as a matter of urgency. I don't believe I have any. Any declarations of interest?
I've received none, Chair.
Thank you. Agree the agenda between Part A and Part B. We do not have any Part B, so we can move straight into Part A, which is the health inequalities and people. Is this you? So I'm going to I think it's a good time to introduce Sarah, who's been leading the work. Councillor Wilson. Councillor Wilson. You all have to keep to the rules. I do apologise.
Oh, you work for the MP.
So I will pass over to Councillor Lewis.
Thank you. Thank you, Councillor. Thank you and welcome everybody and thank you all for coming. Thank you especially to the panel. We are still waiting for one panel member. We hope that they might be able to come along. They might have got delayed, but we are going to continue. But thank you to all the panel, especially for spending time filling out the questions that we sent to them in advance that form part of some pack that you would have read in the agenda. Hopefully you've read it because it's really important detail in there which forms the context of what we're talking about tonight. Yes, my name's Sarah, Councillor Wilson. I'm going to outline the purpose of this meeting and Frank's already gone through how the session will work. Councillor Beaver has already gone through how the session will work. Okay, so the reason we're holding this meeting, we've been doing deep dives at the policy committee of Northern Council into a number of subjects over the last couple of years. For example, we've looked at water quality, we've looked at dentistry, we've looked at the problems facing the agricultural community. And these are all issues that affect North Devon residents, and as council, and particularly as a committee, we feel that we've been looking into them to get a better understanding of these really critical and pressurising situations. So health inequalities is the one we're facing, we're looking at now. Something that we are aware of as a council is a big issue in North Devon and a lot of parts of North Devon. So we want to find out more about it from our experts. We also want to hear from the public as well. And we want to get a better understanding so we can make better plans as a council for the future of North Devon. We're also looking for ways in which North Devon Council can be proactively helping to address health inequalities. And there will be next steps that follow on from this meeting. Health inequalities are where a person or a group has a difference in both access to healthcare and health outcomes. You will hopefully have read our panelists' words and see that health inequalities are sadly widespread in parts of North Devon, and they are linked to social and economic factors. It is scandalous that a group or groups of people should have shorter lifespans due to these factors, but unfortunately, sadly, they do. Nationally, we're seeing the advances made in life expectancy that have been made since 1901 begin to decline. And it's a sad fact that those who need access to care the most are the least likely to get it. So what can we do? It's easy to feel hopeless, but getting together like this, exploring the issues, and for us at North Devon Council, finding ways that we can take action on this is a practical response. We're here to listen to one another and learn and find ways forward. So Frank's already been through the way that Councillor Beaton has already been through the way that the meeting will run. And so I would like to move on to ask each panellist, if you wouldn't mind, just introducing yourself in turn with your name, your role, and a tiny bit about how your organisation works in the health inequalities sphere.
Good evening, everyone. My name is Amanda Howard. I'm the CEO of Age Concern Liverpool, Barnstaple and North Devon. So we look after people who are aged 60 plus, but our larger age groups that we look after are age 80, 85 plus. And we deal on a day-to-day basis of the health inequalities facing older people in North Devon. Many of the problems we encounter are to do with transport and actually getting people to their medical appointments, but also the cost of getting to medical appointments, the cost of parking in the hospital. Deprivation is a key factor in North Devon. Many of people we support are in receipt of pension credit, or should be in receipt of pension credit, but are not yet receiving the benefit. So it's a layered picture really for age concern.
Pharmacy.
Yes. Sorry, Palace, Kelly did tell me, make sure to tell them to put the microphones. Everybody that is microphones as close to the mouth as possible. I've got to say.
Yeah, Messenger Pharmacy and Ilfracombe. So I'm with the owners with my wife. So we basically see everyone from baby right up to end of life care. We see from every demographic really. We see the people who are struggling. Means people who are not claiming benefits have to pay for prescriptions, but they can't afford it, so they go without. So we've got the unfortunate position of trying to advise what's the best thing to take. And from our end, funding is constantly a problem in pharmacy, you've probably heard. And it goes down to even the mailing of staff in the pharmacy to the correct levels and the work that we've got and what patients expect from us. Sometimes that's quite difficult. And then you've got the case of like the drug and alcohol rehabilitation part of it. They are some of the most needy and society, and they actually probably get left behind the most. It's quite a struggle to see sometimes, but apart from that, we're there to help people. We're always there.
Good evening, everybody. My name is Steve Brown, and I'm the Director of Public Health and Communities for the Devon County Council. So my role is quite broad, but in essence, my job description, it says to improve the health of the population and reduce health inequalities. And that's for 833,000 people on Devon County Council area. Clearly, I'm not Superman. So much of my work is working to understand the needs, so it's about data and information, and to use that to support colleagues, whether that's in the NHS, in district councils, in local authorities, in Devon County as well, through what we call a joint strategic needs assessment. So all authorities have a responsibility and a duty to reduce inequalities. They also have a duty to take regard for the joint strategic needs assessment. And that JESNA, short, tells us about the health of the population. And as Councillor Wilson said, the last decade or so, we're not living longer. In fact, in some areas, people are living less long. And I'm sure we'll come to it later, but the critical for me is about the healthy life expectancy and the inequalities you have around that. So as well as that big role, I also have a little bit of money and I have to buy some services. So we have, for example, health visitors and school nurses come under my watch, as does the drug and alcohol services and paying pharmacists to give supervised consumption is one of them. Sexual health is another example. We'll also have the libraries and the youth service and community. So a fairly broad area, but as I'm sure we'll come on to, trying to tackle inequalities is not a narrow subject, it's a very broad subject. So that's me.
Hello everybody, my name is Beth and I'm here representing the In-Room MP. As an MP's office, we receive a vast amount of casework based on healthcare access. So in that respect, we get a good idea of where the pressure points are in systems, where people and constituents are being failed across North Devon. So yes, that's why I'm here. And I also worked very closely with Ian in setting up the North Devon Dental Steering Group, which he chairs. So in Talent, also representing them. Yeah, thank you.
Hi everyone, my name is Sabrina and I manage the North Devon Coastal Primary Care Network. So that's a group of general practices. It's Ilfracombe, South Malton, Gaunton, Woolacombe and Carmarthen. And very much like community pharmacy, being general practice, we have the privilege of caring for everyone without prejudice for the entirety of their lives. And we do see a whole wealth of health inequalities and the many aspects to do with that. We see people, patients that can't attend a GP appointment or a blood test appointment, they can't afford to come for a weekly blood test, or a weekly blood test, they can't actually get to the practice. We see patients with poor health conditions because they're living in cold and damp homes and can't afford to move to a home or do anything to that house to make it warmer and drier. We're also seeing people that are unwilling to engage with us and unable to engage with us, and that's something we're working on a lot at the moment. So there is a whole wealth of health inequalities that are facing us, and we're doing a lot of work at the moment to understand that in more detail and how we can tackle that. And I think that we're all here together, but I think it is a joint effort. I don't think any one of us could do it alone. It really is a community effort that we take.
Thank you, everybody. We're now going to move into the councillor section where councillors questions panelists. And just to remind you that you're addressing your questions to all the panelists. We also have one councillor who's joined us online, so we'll just keep an eye on that as well, in case there are any questions online. Can I start with one question to kick off? I wanted to ask, in the responses that you all gave, quite a lot of you talked about digital exclusion as being a factor in health inequality or challenges to accessing health care. And obviously it's only one element, but it just pricked my curiosity because I've always associated that mainly with older people. But I wonder if there is a broader picture of digital exclusion and whether it's bigger than just elderly people struggling to use phones and apps and things, whether there's something deeper or more complex going on with that. So I just wonder if any of you had any more that you could tell us about digital exclusion and health inequalities.
Yes. Yes, then. If you test it now.
That's the now. I would. Really, really good question. And in fact, we've just in the public health team produced, about to be published, a digital exclusion piece of work to really get to the question you're answering, because I think we can jump into the correlation between digital exclusion and age. But actually, if you look at the data, there's a correlation between digital exclusion and inequalities of deprivation. So it's kind of a two-pronged approach, really. I literally had an email this morning, so and I had a quick scan of it. But once it's been finalised, I'm more than happy to pass it on. But points were made. It's not just our perception of the older population who are digitally excluded because they haven't grown up in the digital environment. It's also inequalities associated who can't afford to access the internet, access to broadband, access to the computers and the digital phones and what have you as well. So there is an inequality correlation.
Thank you.
I wanted to add also that digital exclusion is going to become even bigger of an issue as we phase out from the copper analog landline. As an MP's office, we received quite a lot of correspondence from people who are genuinely really quite anxious that the landline will be phasing out and that it will be going on to all digital. I mean, that also poses problems for things like telecare systems and things like that. And I'm sure maybe you've got more to say on that because that's something I don't know too much about. But I suppose it's just something that is going to become an ever bigger problem if it's not thought out or tackled faster.
Just come back on.
Yeah.
Yeah, that was really interesting, Beth. Steve, did you have a comment on that, especially with the? I assume you mean the dear old red button will be. Yeah, and I think that is an interesting point. Amanda might speak on that.
So telecare is imperfect, but it is widely used and it does help a lot of people. It gives a lot of people reassurance, even if they never use it, and that can be really helpful for mental health for people who are living alone. So do you need to find a way to retain telecare, even if analogue service disappears?
Thank you. Just a final point on my question before we move to the councillors. I also wonder whether, as well as, I think I understand what you're saying, Steve, is it is partly an age, but it's age plus inequalities added together. But also I hear a lot of people saying that they don't want to have digital appointments with the doctors, they want face-to-face services because they find them more reassuring. So I imagine that's another aspect of it. Yeah.
So of our older age group, the kind of 80 plus, only 4% of the people we support use IT. So more carry a telephone but never switch it on or were doomed to use it. Only 4% actually use IT. So it is a huge health inequality. We actually sometimes have to go to people's homes with our own mobile phones so they can have their GP appointment over our phone because they can't do that for themselves.
Councillors, so I believe Councillor Coote, do you have a question?
I've actually got two questions. So the first question really is around pharmacies. Do you think that members of the public are fully aware of the services they can access at pharmacy? But also in turn to that, I can see that there's extra roles being put on pharmacy all the time. What type of pressures is that having for pharmacies?
So first of all, I don't think people do in general. Quite a few people do. We find, which is probably more about education, when holidaymakers come, they're better informed about the services that pharmacies provide. Locally, they're not quite as much. You might have seen me on the billboard or a bus recently. People go in pharmacy first, which is several conditions that pharmacists can help you with. Sorry, more effective, not apologies.
So on from that, the pressures that are being put on pharmacies because pharmacists are having to do more and more of roles that are expected of the pharmacy.
So dispensing pharmacies roughly going up about 3% a year. So I can't remember how many billion items it was last year. It's 3% every year on top of that. I know that dispensing is going down and it's going more towards service based, which is fine, but there is going to have to be a crossover at some point because funding is not, the service funding is not going to replace dispensing funding to pay for core activities of a pharmacy, which in the 10-year plan they're looking at moving dispensing away from pharmacies. I don't really see how they're going to do it. I can't see pharmacy somewhere picking up some GPs and straight away, meaningful straight away, end of life care. It just can't see it. But
Could you just speak a little bit closer to the
sorry. I don't like these things. Yeah, so I can't see that they're going to pick up the slack that pharmacies do. It would be lovely if they could, so we could focus on services, but and then that comes down to if we're not got the funding coming in, we can't get the right staff. And for us here in Ilfracombe, especially getting a pharmacist is very difficult. You have to pay a lot more than London. It's silly that the rates in London are lower than they are in North Devon, which is just a sheer location issue. People want to live near a major airport. There's a lot of pharmacists are, which is fine. I don't mind. I'd love more pharmacists, it would be great. And then the other part for us is we say like this additional roles reimbursement scheme. It's been devastating to community pharmacies. They're taking pharmacists away from them, but then you've got pharmacies shut. People have lots closing. I think they're now under 10 hours in England alone, which is the lowest level since 2015, I believe. Which again all come from around funding. I feel like a broken record. But there has been decrease what moved up to 30% over the last 10 years for pharmacies. It has gone up this year. It's now up to 3 billion, but the economic review paid for by the NHS and the Department of Health says we're still £2 billion short. So you normally need 100% more. That's only going to increase year on year. It's great what we do, but it's hard. Because you just cannot get the stuff. You don't have time. But modern technology is helping us because taken the checking away from the pharmacist with the use of computers, which is very good. Is how when you just put it in, it's saving time. I agree.
Sabrina? Harrison?
Well, it's PCN for mental health.
Sorry.
Yeah.
I thought as PCX mentioned, I should come in. I completely agree with you, actually. So the R's roles that we're talking about are those additional roles as GP practices, and they include pharmacists. The pharmacists and GP practices are doing structured medication reviews, hypertension reviews, looking at medicine safety, and it's a really valuable role, and they're needed, but they're needed just as much in community pharmacy. And I think it's really reflective of it. I don't think it's unique to North Devon, but certainly one of our individual pressures about recruitment. We really struggle to recruit. I'm trying to recruit for 4 different roles at the moment and have no interest, and it sounds like a similar situation for being, and that's reflected everywhere. We do struggle to recruit into those clinical roles, and that's been going on for a little while now, and it is having an impact on all of us.
Thank you. Councillor Walton?
I really want to go back to what you were saying from Councillor Wilson's question earlier. It seems to me that some of the older members of the population are getting a lot of phone calls that are actually scams, and I just wondered whether you've actually experienced this. I mean, myself, for example, I've had in the last month probably 3 phone calls from people pretending that they're from Microsoft and wanted to get into my computer, etc. I've also had a phone call saying somebody has taken money from your account and will you press this particular number and phone us back and so on. I've also had people phoning from 0113, which is a Reading-based area, which they've been basically saying phone us back with a particular reference number and so on. I've had that probably for 6 months. Probably once a fortnight from 6 months. So I know it's going on because I've had personal experience of this happening. And I just wonder whether I'm unique or whether a lot of other people are complaining of the same sort of thing. So I wanted just to mention that, seeing when we're talking about digital things. Thank you.
Thank you. I don't know if it's directly related to health inequalities, unless somebody feels
Well,
that
It is in a way, because, a concern and our MP and so on ought to be aware of this going on, and it is affecting probably our older members of the and can cause mental health issues and people losing a lot of money, etc.
Yeah, go on, man. It does relate to it all.
I was just going to say that it is quite common over the telephone and through the post. It does cause anxiety, which can affect health. There are some tools that you can use to protect yourself. I don't know who your telephone provider is, but telephone providers can put scanning software and protect you from some of these calls. But the Age Concerned North Devon Help Desk does take a lot of calls from people asking about, for example, energy companies wanting additional payments and wanting payments, or they're going to cut off your energy in deepest, darkest winter. I think there is a general awareness amongst a section of the population that it is a real problem.
Thanks, Amanda. One of the areas of my responsibility, which I didn't say because I forgot, is training standards. So training standards comes under my area, and the head training standards, the Kia, obviously this morning actually, and one of the people about was scams. So obviously it's quite a complex, big area, but rest assured, our training standards guys are on this. in terms of scams being one of the key things. With inequalities, is basically if you want to scam somebody, who do you pick on? You pick on probably some of the most vulnerable people, like this one, some of the most vulnerable people in town, because and also that data shared. You're always the one person to respond, and that data is shared amongst the crooks. But tackling scamming is one of the key things on our priorities for this coming year, because we know what's happening, as is things like illicit tobacco that take place like that. So I'll urge if anyone has any information, then play through, and we'll have those over playing through to our training standards team. They can log it, and then you start to get a pattern.
Thank you. And also, Councillor Morgan, the community safety partnership, this is the priority that they've been talking about. So I think it is right there. We as a council are putting all that into public awareness and all the rest of it. So I think that probably through the community safety partnership, where we should really press this. Thank you.
Thank you, Councillor.
Okay, I've written it down because I already rambled otherwise. I know there's been very little mention on the questions and answers here about a section of our community, which is the rural community here in North Devon. Having spoken to my own GP, they say the biggest increase in patients visiting their surgeries is from the distressed farming community. Are other GPs or anyone else on the panel noticing an increase in farmers and those in the allied industries accessing their surgeries, and also, with stress-related mental health problems, considering the increasing pressures they're under? And I'm just wondering what help you can give them, please.
I'll start. So, yes, it's a short answer. We're definitely seeing rural and coastal communities that are suffering from isolation, and again, that's inability or unwillingness to engage in household care, and there is a mix in it. There is work being done in Holmesworthy, which is they're trying health checks in farmers markets and trying to take it to them, and that is something we would love to do. I've been doing some planning with health checks for quite a while, and trying to get some funding to pilot some ideas. That's always very difficult when you want to try do things that are going out to the community or costing more or exist outside. Exist outside the usual NHS model, but there is a cost attached to them, and it's a bit of a struggle to get funding sometimes. So we are trying to look at different ways to do that. We are currently doing some work on cervical screening and trying to improve uptake in rural and coastal communities. How we can look at the timings of our clinics, how we can communicate in different ways, and just really reassessing, are we doing things in the right way? And the answer is probably no. When we're inviting people to engage in healthcare, it's probably a blanket message that goes out to everyone, and it shouldn't be. It should be different, and we need to be doing things a different way. So yes, we're definitely seeing that. It's definitely something on our radar. We are doing some work. We're probably not doing enough, but we're trying to do more.
Just to add to that, the one in terms of morality, particularly on the farming community, particularly men. So when you look at Devon as a whole, we've performed pretty well against lots of the indices, lots of the targets. We don't perform well against suicides and self-harms. When you look at the data, it's a big flash in red in terms of how we perform. And that hasn't been recent, that's been for a while. And it speaks to the point around we have lots of people working on their own in rural communities, not necessarily having interaction with people. So we know it's an issue. The health checks is, again, we'll try money later because it's not my responsibility. But it's a really good example around inequalities. So the NHS has a health check service. It's 50 to 74 euros every 5 years. So every 5 years you should get called for a health check, and it's what I would call a universal service. So everybody gets the invite from their GP every 5 years. That's the theory. We don't always happen because things like COVID and what have you, we get about 10%. But what I'm trying to do is yes, we can do a universal offer, but who's going to turn up? We know who's going to turn up. It's being the people who are informed, able to get there, And that just exacerbates inequalities because they're living by hypertension, they've got the right medication. So the work we're doing around, okay, it's going to cost us more money because it's going to be harder. But how we go and reach those communities, those individuals who are eligible, but aren't going to turn up at the local GP with a letter saying, I'm not going to health checks. You need to work harder and go on to wherever they are. And from a financial point of view, it costs more money. But boy, that's what you need to do for tackling inequality. So we are doing targeted health checks. We could talk later, providing some of the money, and we're trying to do things differently. But that is inequalities response in action, what we call universal proportionalism. So you offer a universal service, but you proportion it to those who most need. And that invariably costs more and take longer time, but that's what we need to do to tackle it.
Thank you. And I'm conscious that our representative from the Farming Communities Network isn't here, but in his responses, he did talk about the inability of a lot of the farming community to get to appointments because the surgery or pharmacy opening times don't match with agricultural working life or 0 hours contracts where you might lose pay in order to be able to go to the doctors for etc. So yeah, that's targeting of flexibility is something that seems to be quite a lot.
Yeah, just really quickly, so Councillor Wilson. The yeah, I mean, also a member of my other role is that I'm also a member of the Green staff. I think big thing that comes into our inbox is those isolated communities that are left behind the broadband rail layer. I think that's something a huge difference to a lot of our farming community. If they could access decent broadband, then they wouldn't have to leave the farm to go to help. They could engage. So I think another example really where we really do need to connect everybody so that everybody's got their chance.
And to what, or just asking a question, yeah, you can also. Yes, and I mean, you mentioned, I guess you are aware that farmers markets like up on Exmoor, Cupcombe, Blackmore Gate, Stagemore, up in, which is the biggest market in the country, they do have healthcare checks that it can be farmers. And it's unfortunate the gentleman here from FCN's not here tonight because they've started organising like coffee mornings and things like that, just to get farmers together to talk. And it's getting the farmers out there talking, you know, once you talk to someone, the problem's not so bad, is it? So, thank you.
Thank you. Next question, Councillor Jones.
Yeah, before I ask my question, just following up on that point, you talk about the cost of reaching these harder to reach communities. Surely there's a cost saving with early intervention. There must be, hopefully. So, staying on the theme of rural issues, I'm the councillor for Woodbridge. I get regular calls and concerns. It's about 10 miles to get to get to the hospital for our community. Now, some people don't have access to transport. The bus network is absolutely appalling, and we've been working really hard to try and see an improvement to that. There is a specialist service, I believe, but that service is inaccessible, so it's too expensive for a lot of people to use. And in terms of the bus, if you can actually get on it and get it, the bus stop for the hospital in Tiverton, because then you go to Tiverton rather than North Devon, the bus stop to go is outside the hospital, but the bus stop to leave is about a 15-minute walk if you're struggling to be mobile. So they need to walk to another road. That was as of last year. It might have already been addressed because it was brought forward, but it sort of sums up the issue. So I just wanted to ask: we've seen a decline in investment into transport, particularly bus and public transport, to really impact the rural area. To what extent is that a problem?
There are 7 community transport services in North Devon, which do, between them all, cover the whole of North Devon. It does cost a booking fee and a 50p per mile mileage fee. The people who use the community transport service are generally all older people. Occasionally it's a younger person who's broken their leg or something, but generally it's all older people. And people are collected from their armchair, taken to their medical appointment, waited with, and then brought back to their armchair. It is a good service. It is run by, the drivers are all volunteer drivers driving in their own cars. Over half of the drivers will transport wheelchairs and walking frames and push wheelchairs and help people. There is a bid in with the big lottery for £500,000 to double the size of this transport provision. So it's currently providing about 250 journeys a week, and there's a funding request to increase that to 500 journeys a week. And we're just waiting to hear whether or not we've been successful with the funding. One of the big problems with these services is they're not well known about, they're not advertised, and that's because they're all at capacity. So the service that Age Concern provides, which currently does about 100 journeys a week at the moment, on top of that, we turn down 30% of all calls, and we have no one to refer people on to. So if we can't take them for their medical appointment, we can't say try this organisation or try that organisation. It is a problem, but I think it is a solvable problem. We just need to find the funding to solve it.
To answer your question, which was, do you see that's a problem? I just wanted to say yes. As the MP's office, we receive so many people contacting us who are really quite who are struggling with that. Actually, Witheridge is a place, as well as Linton, that has been another place that has been in touch about precisely that issue. We talked to Stagecoach, not actually about health reasons for getting on the bus, but just in general. Linton, especially when it was struggling with its GP service recently, people were really worried that if there's a reduction in GP service, they'll be having to travel quite a long distance, and especially in a more elderly population, to get to the next nearest GP or primary care station. So yeah, it's a problem that we get in the office quite a bit.
Thank you. And from my reflection, I know for community, we've got an excellent community transport service, but as you were saying, Amanda, it's largely dependent on volunteers, so it's very fragile as well, vulnerable, and sustainability could be an issue there.
Just to echo what everyone else has said, there's no one that should not be able to get to a medical appointment because they don't have the transport to get there. That shouldn't happen. And if someone misses their diabetic appointment, their diabetic review, because they can't afford to get there or there isn't a bus to take them, that will have a fundamental impact on their health. Their diabetes will probably get worse, it'll become unmanaged, and then they'll contact that, and we can translate that to every other long-term condition that a patient has. So it really is an issue when we hear about it a lot. All of our practices have access to wellbeing teams, so they're there to support patients with things that aren't medical, but we know impact their health, or there's work to turn health. And one of the big things we always get, they always get referrals for is access. We need to support the patient find out to get access to their GP appointment. And all those services that you said are incredible, but they've got the problem where else for them to go. It really is very popular.
Right, thank you. I don't know if Hannah can actually answer the question, but I thought I would pose it to give you some food for thought. As we know, quite a few of our minor injury units are under threat of closure, Ilfracombe being namely one of them. And I'm just wondering what you as a panel feel the impact will be on the residents, and if you have got any influence, are you able to
kind of petition on behalf of them, or are you able to kind of, I can't think of the word, sorry, but you know, are you aware of these problems and are you actually going to be able to support the residents when this does actually happen?
And perhaps Councillor Kim to also ask her question to you. So we've been really quick.
Yes, so we've recently seen about the ambulance service and looking to cut the contract to phase out with the fire service as using their first responders. I'm just wondering what your views are on that. Personal experience that my dad has had 2 epileptic seizures, and the first responders for the fire unit took quite a long time for the ambulance crew to come, and luckily they were able to get in, wanted and given oxygen in that time. So what's your views on that?
Anyone have I can't comment too much on the ambulance because I don't know the situation of it. Although my view is there absolutely should be ambulances attending patients in a very timely manner. That absolutely should be paid. In terms of the minor injuries unit, and particularly of what you talked about, yes, we're aware of it. We're trying to have conversations with the LPB about that, to see what it can be done. We are waiting to hear back from a response from the moment. So, yeah, we will continue to chase. And it will have an impact. And again, that's a very local place for patients to go. And if they're unable to get anywhere else, then what happens with that? Yes, it will absolutely have an impact on coastal practice in the medical centre. There will be an increase in demand there. Some of the things King Coastal won't be able to do because they're not a minor injury unit. And then it leaves patients with a gap in the provision that they should receive.
Just help on that as well. Ian and RF are also well aware of the minor injuries unit in Ilfracombe, and Ian has met with campaigners and he's been in discussion with the ICB and is doing all he can to discuss and think about options and address that, because obviously it is a really important service. And
wasn't no comment specific on the MIUs, but just in terms of trying to look ahead and be optimistic. Perhaps the 10-year plan, and this is the NHS plan for 10 years, and it absolutely talked about the neighbourhood health services, and the model it describes is a multidisciplinary kind of team all working together, a one-stop shop. Now, most of the country don't have community hospitals, for example. We're quite in a privileged position now to have community hospitals. So it might be an opportunity, but how do we configure services at place in neighbourhoods to support individuals? And I don't work with the NHS, but you can't not think about the MIUs we have, the community hospitals we have as key assets, key buildings in those communities. Why would you not try to build around the community health service around those things we have? Just on the MIU bit, what I have done, a bit of work I haven't been in is to grow inequalities, is when you're thinking about what's on MIUs can no longer afford to keep open or we can't staff, think about inequalities in those decisions. Because historically, things closed on, point out to them that, in doing that decision is likely to increase and exacerbate inequalities. Look where you're closing that. So the bit of work I'm trying to do is with all my decisions, and not just within the local authorities, but also in partners. They take the kind of what we call health and law policy. So think about the impact of that decision, and is that going to increase or reduce inequalities? And I sit on scrutiny panels, and Councillor Baines there as well. And one of the things I always suggest that members ask in any policies coming across their desks is, how is this going to reduce inequalities in ... North Devon, South Thames, West Devon? Because you should be able to answer that question, and if you can't answer it, I suggest probably it's going to exacerbate inequalities because they haven't thought about it. So put that one in your back pocket, and next time maybe officers come through asking that question, how is this going to reduce inequality?
Thank you. I'm just going to public, those that eagle-eyed in the public, you'll reduced our time. We'll give you your 40 minutes on yours. So we have slightly gone over on that section. So it's now just going back to housekeeping. I need to ask the committee if we can remove something also the second. So let's move from Councillor Jones, and seconded by Councillor Bushell. All those in favour? Thank you. So back to you, Sarah, and members of the public. You can ask questions. Can I please, the councillors were pretty good. One or two stretched it. If we can keep the questions really succinct and then and also panelists short. Obviously, we'll answer a question, but let's try and keep it as short and as possible, and we'll get through yours.
You, members of the public, if you'd like to raise your hand if you've got a question. This gentleman in the green t-shirt.
Thank you, that's really good of you. I just wondered if the panel had any thoughts on the new family hubs that have been suggested by the government, which are going to be opening in every local authority area in England.
I think there's that probably directed towards me. So I think it's a good thing. I think health starts in the womb. So this is about the government saying best start in life. Those first 1 days are so important for child development. As you know, in Devon we cannot receive any funding for family hubs, unlike Central Bay. But I did receive a letter yesterday saying that those areas that have not received money in terms of family hubs will have some funding coming to them in preparation for April 2026, when there'll be a new family hubs. I think it's Families First Start program or something, but in essence, it's what we would say family hubs. So we should get some money, and that will allow us to roll out in preparation for 26.
Let's have anything to add on family hubs. Okay, I think we have to hold up.
Thank you. I mean, there's so many questions I'd like to ask, but I'm from Milford Keynes, which sadly has got the worst deprivation statistics in Devon, with the exception of Plymouth, I believe, and the worst health inequality actually go hand in hand. I want to talk to you about prevention. In Milford Keynes, we're having services stripped out left, right, and centre. So when I talk about prevention, I also talk about treating conditions before they get worse, so that includes minor injuries. We talk about family hubs, all of the universal early years provision will be going, which is so important when you're trying to educate families about the importance of diet, healthy lifestyles, etc. And of course, my favourite, mental health, where we've had mental health support taken away from Milford Keynes. So I want to ask the panel what your thoughts are on the importance of prevention and how can we increase preventative work in our communities.
I'm holding this, but I'll be short. Right. I think I have to do it. Yeah, prevention is key. I've spent now 30 years of my career trying to convince those with deep pockets that prevention is better than cure. And I've seen this is not political, but I've seen numerous different Secretary of States talk about prevention in their latest plan. They talk about moving from treatment to prevention. All sounds wonderful. My budget has been cut by 26% in the last 6 or 7 years, and demand for those services has gone up. That to one side, absolutely. Prevention is better than curing, and when you talk about joining young people in early years, actually we just put together an early years strategy, and I'm going to drive that through my department, working closely with our children's services. The children's service department are dealing with kind of the top of the pyramid, if you like, in terms of need, and that's rightly so. Really vulnerable children and young people who need absolute interventions. So I want to drive through the early years, which is about the prevention. How do we support young families and to have the best start in life? So, commitment to you, we'll be doing that against a backdrop of reducing budgets, but there are things we can do. I think critical for me is around how we work with the community, and we can't be everywhere, but can we give people the tools, the experience, the skills to pass on. We've got some really good experience and examples work with the community voluntary sector. You can do that, not on our behalf, but with the right training. You also talk about prevention. When you talk about prevention, you talk about secondary prevention. So people who are identified as having a condition that could be hypertension, for example, and our colleagues in primary care and a big drive, we know we're not getting anywhere near the number of people we should be who are walking around on Devon streets with high blood pressure. And at any point, being brutally frank, that could stop at any point and they could drop down dead. And we are driving to do more outreach to get the blood pressures done in farmers markets, our communities. And it won't be surprising how many people we're picking up and we're able then to offer them optimal treatment and save strokes and heart attacks in the future. So we need to do both. We need to what I call the primary prevention, the early step of one early treatment, but the secondary prevention is really important.
The next question from former Councillor Mike Evans from the back.
Thank you. I want to stand up and just come out of hospital. And thank you for attending this meeting. First of all, I'd like to say that I've been in hospital on and off since the general election, and I can't fault the service that I've had from North Devon District Hospital or from the local GP. They've been very, very good to me, and I wouldn't be here without their help. And I also like to thank Dr. Lynn in Derriford for all that they've done. What I'm concerned about is that I was in the hospital in North Devon, and they decided that I had to go down to Derriford to see Dr. Lynn to see whether I could have the next phase of the treatment that I have, because I've got a cancer in the brain. Anyhow, they decided that at 8 o'clock in the morning I would leave North Devon and go down to Derriford. 11 o'clock, I was still waiting for the taxi, for the ambulance to come along and take me down to Derriford. I stayed with one nurse who came with me and 2 ambulance people, and they took me all the way down to Derriford. When we arrived at Derriford, just before that we left North Devon, they ran Derriford to check that they would still see me because it was so late in the day. They said they would. We got down to Derriford, and as soon as I arrived there, they put me and the nurse in a separate little room. It couldn't be much more than about 8 by 8, and we stuck in there all day until after 6 o'clock at night. And when they came back, they drove us all the way back to North Devon, Southampton, via Torbay and Exeter. And we arrived back at the hospital in North Devon at gone 9 o'clock at night. I had to ring my wife to bring some food in because I hadn't had anything to eat all day. Now, my concern is that I've had to do that trip on about 5 occasions now, and each time we get down to Derriford and there's never an ambulance or anything to bring us back, and we're sitting there until about 9 o'clock at night waiting to come home. Now, when you're not very well, that is an extremely long day from about 8 o'clock in the morning till 9 o'clock at night. Now, there needs to be better understanding and working between the ambulance service and Derriford and North Devon to look after patients that are travelling down that way, because it's a long way to go when you're not very well. Thank you.
First of all, I'm really sorry to hear about that experience. That should happen to nobody. I mean, the point you raise is a really good one as well, because we are the most remote acute hospital in mainland England. And that's why, as an MP's office, we're doing all we can to fight for investment so that people don't have to do that more often. And thank you for sharing the situation. I'm sure that's important for everyone to hear. It's just as a real signal of how things really do need to get better.
Did the lady in the like Barry t-shirt first of all have a question from early on? Could you put your hand up and then put it down?
Just wondering if the channel or the council is part of the Rural Services Network, which is a national organisation that looks at and has health areas it's all to do with so across the country all rural health areas, and they have convened panels and look at these.
I believe we will get newsletters, a regular, yeah, so you must be subscribed to like Red, we get a regular newsletter in our inboxes as councillors. That's right, isn't it? Yeah, and I have been to 1 or 2 webinars on that.
Yeah, I think it's a really good point, because I mean, as councillors, we get hundreds and hundreds of different, obviously emails, but also circulars. I think it's a really good point that this time that we decide to have and highlight. Perhaps that would be one of our actions, that we emphasise that the still provided councillors as well to like the importance of reading those sort of briefing papers, because that's effectively what they are. They are incredibly useful, and we're trying to carry out our community role. So, yeah, thank you for that.
Next, gentleman in the white shirt.
Thank you. Just to introduce myself, my name's Nigel Moody. I'm a GP. I work 2 days a week at Flemington as a mainstream GP, and I work a day a week at Freedom Centre as a specialist inclusive health GP who, along with my colleague here, Louise Canterbury, look after the most deprived in Barnstaple. So that's the homeless and the London House. It's taken us 4 years to get funding from the ITB for this service. Prior to that, it was funded by piecemeal costs from North Devon Council. My question to the councillors and the panel is, how seriously do you take this issue of deprivation and health inequalities? Because we formed a community interest company and we can help with this. So if you have funding, if you can get us funding, we can provide some services that will help with access and engagement. The key thing that I've heard from this evening is about engagement of communities. So that is a huge, and it was a huge problem for the patients that we are now seeing. For the first 6 months of the service when I was running, I would be seeing 1 or 2 patients a day. I'm now seeing up to 17 or 20 patients. They're trusting me. They put their trust in ourselves and our service. Now that's easy because we have a place that they come to, Freedom Centre. There are fantastic models across the country, hub and spoke models, where if you provide a bus, community bus, to go out into outreach to all communities, not just talking about Ilford, but all of the rural communities as well, we could do that. So how seriously do you want to move this forward? That's my question.
Thank you. That's really, really interesting to hear that. And I for one, take it very seriously, and I think that's something we should be looking at. We're going to be talking about what North Devon Council can do as we wrap up this session. So, this is something we can bear in mind. Next.
Actually, it's one of my questions, really. For years now, Ilfracombe has figures in the deprivation indices. Various initiatives have been brought in. We've seen some improvement, but they've been short term. They go, and then it carries on being a problem. Why is it that when you recognise areas which have inequalities, you don't do something about it on a statutory long-term basis? Why is that not done? Why do we have, you say we're lucky to have community hospitals? We've had our beds shut. We fought for our community hospital, and it's getting worse and worse. There's fewer and fewer services. MIU being latest. So how do you, having determined somewhere is suffering inequality and deprivation, how can any of you let it happen over and over again? How can it continue over and over again, especially when the same county, in the glorious south, you know, you have the MHIU around every corner, for example. So tell me what it is, what the decision, what decisions are made and why are they made to carry on allowing Norfolk to get worse?
I wasn't being funny because I don't like the author silence after. I can't speak to kind of statutory rulings and any wider scope of legislation because it's just way above me. What my own thoughts are is the reason we always get stuck is because we are lots of smaller organisations or bigger organisations. We all have a lot of heart, there's a lot of passion, certainly individuals or small groups within the NHS, within local government, that really care and that really want to care for our patients and care for those that are suffering from health inequality. But what we tend to have is these little pockets of funding that we're fighting for, and we all go off and try something, pilot something, and it'll have really good kind of outcomes, and we'll try really hard and it'll be brave, but because we're not doing it together, the impact we're making is really small. And actually what we need to be doing is working together, because health inequality isn't addressed by any one of us. It's looking at housing, it's looking at transport, it's looking at healthcare, it's looking at schools and prevention, it's looking at women's health. There's a whole host of things that take so many of us, and what we're really bad at is talking to each other and coming up with a solution together, and we are bad at that, and that's what needs addressing. Right.
Things we used to have that sort of joined up care and services. We used to be able to say our services to meet needs require this amount of money, go to government, and you would get the money to meet your needs. We've had 15 years at least, if not more. Actually started in 1990, but basically the last 20 years of having our services fragmented and then have the cheek to create something called integrated care. Sorry, it's not a question, it's just a frustration, an irritation, right? You're not integrated, you're disintegrated. And it's a greater cost to disintegrate than it is to work together. We no longer have a national health service.
That's right. I mean, I absolutely, I think anybody, I'm just a little bit concerned about where you went there, because I mean, I think we got a wonderful. Yeah, you did sort of make the acquisition. Those made this decision. I think I don't disagree with an awful lot of what you're saying, but it certainly wasn't anybody up here that's made that.
Integration.
Yeah.
That we've had fragmentation.
But I think the important thing to your original question, I mean, you have got county councillors here, you've got district councillors here, you've got MP staff here. You know, I think you make a really, really valued and important point. We've got the chair of health screening, which I think is incredible. Just taking the time to drive up from Patricia Mary to make sure that voice is going on.
MIU. They've got an MIU.
Exactly, yeah. I mean, I think, you know, the point is really well made. I think it follows on from Dr. Mooney's comments really as well, isn't it? You know, I mean, we have got so many isolated communities, finding a way that we can move to those communities, whether it be through the work that they're doing, the MIU, children's hubs, all those sort of things. You know, we do need to be able to move to, because we're not going to get stagecoach providing coaches, buses everywhere. So actually, what we probably can do is how we get the professionals out there.
Thank you, gentlemen, in the checked red shirt.
Thank you. My name's Adam Crispin. I run a home care company called Home Instead, and quite a lot of tonight we started off talking about inequalities and rural inequality. I don't think we've covered probably enough in terms of transport and people being able to get to, and there's the rural digital exclusion because of lack of signal and broadband, but also travel and transport and people being able to get to social things. And that is a real challenge that we see. And then I also chair one Southampton, and there's a big problem in Southampton. People can't get to Exeter College, so we have students who are not able to get to Exeter College because there is no bus service, and there's a petition ongoing to get a bus between Torrington and Umley Station in Southampton, so that students at both ends can get there, but it hasn't got enough numbers at the moment to go through. And so talking about exclusion, and we know that lack of education is one of the big factors of health inequality as people age. So we're telling students they can't get to the college they want to go to, they can't do the course they want to. What does that tell them about our expectations or our kind of thoughts for their futures and careers if we can't get them educated? But also, kind of pick up on the previous point the lady was making, how are Devon and North Devon councils going to integrate with primary care networks and the NHS ICB in terms of funding when all the things are so disparate? Because preventative care now will cost, and it sits in one pot, whereas all the budget has gone to acute hospital, well, not our acute hospital, but the NHS in inverted commas, so the budget is, the money's all being spent to reduce waiting times in A&E and consultants. But we know that we can reduce that at the other end, but it will take longer, as you pointed out, but that is going to need budget. So how is that going to work? There's no way to keep panelists here.
I'm happy to give a couple of reflections. So about transport and access and movement. So that social mobility, like we know in our large rural communities, coastal communities, you've got to be one of them, we really struggle with social mobility. So people haven't got the jobs necessarily keep them here. So young people leave, and you're seeing a big wave of an ageing population who are coming into Devon, recently retired, that's great, and then 20, 30 years later, and I used the word advisory about that kind of ticking time bomb of an ageing population and a lower younger population. Our birth rate is reducing. And social mobility is a critical bit. Where are the jobs? Where's the transport to get people educated? I haven't got any of the answers, but they're part of the conundrum, aren't they? And the other bits around the ICB and the changes. So, just when you get things sorted, the ICB is going to change. So it's going to become a Devon Cornwall cluster in the coming months, probably even sooner than that. I mentioned earlier about the 10-year plan, colleagues next to us, and working to have a view. That is meant to be talking about taking stuff out of hospitals, acute care into communities. My issue being the money never follows it, and as long as central government are putting targets which primarily focus on the acutes, where's the energy going to go? Where's the money going to go? And it's going to go measuring waiting times, measuring times for ED, for example. It doesn't necessarily go on how many people you support them to remain independently at home, how many people can you get their blood pressure checks. Those things aren't the second thing. There are a lot of things being supported. There is a narrative in the paper, so a little bit of optimism. Are we going to create these community health services where we have all the agencies working together? We have the funding to do that. I don't know, and that's what's written down, but it's changing from what's written on policy to the action. And my experience over the few decades is the action follows where the targets and where the money is. I say no policy, but I remain optimistic.
And just to add that we did invite the ICB to this meeting, but they said no, they didn't come. And thank you for bringing up the young people, because I share your concern about their access to education. Charmaine.
Oh, yeah. Oh, there you go. So we touched on it a little bit, and it's more of a reminder rather than a question, but we talked about volunteering in communities. We know that when services are reduced or taken out completely, there's always this idea that the community goes backfill, and there's real danger. So I'm just kind of trying to remind you to make sure when you talk about health inequalities, to remind how important it is around the role of volunteers. Quite often they're left with no training, which is a real kind of safeguarding issue, and also there's no kind of support from the kind of more statutory organisations and those bodies. So when you're faced with people who are with a crisis, you should be able to pick up the phone or phone somebody who is paid to do that job. Quite often that doesn't happen. And as Councillor Wilson mentioned, it's quite a fragile kind of system with volunteers. You're reliant on the goodwill of the people. I'm sure probably Amanda's got something to say because obviously they work a lot with volunteers. But it is just to remind everybody whenever they're looking at health inequalities, just remember about the volunteer sector.
I have to say that the volunteers in North Devon are remarkable. So Age Concern has currently got 134 active volunteers. So we've grown from having 25 volunteers 3 years ago. So huge commitment from the community to help older people. But the funding to train volunteers and support volunteers properly is just not there. We run our services we have funding only for 2 months ahead. So we're always just looking at the next 2 months and how we can survive the next 2 months. And our waiting list for services are nearly as large as the service provision itself. So it is a little bit heartbreaking, but the volunteer support within the community, I find that it's definitely there. It's just finding the funding to support that is really challenging. Thank you, gentleman at the back there, yes.
Thank you. By way of a challenge and a little bit of a question, probably not a colleague over there saying how much do you care? One of the last members of the panel and both councils represented what we've heard from the 10-year plan about these neighbourhood health centres. We don't have the detail yet. But would they all support lobbying the various bodies for a neighbourhood health centre in Ilford? Yes, I'm related to Ilford, and you've heard quite a lot about it tonight. 20 copies my name. It's something you put into your summary at the end of the meeting as a positive outcome.
I think for me personally, it's, as Steve was saying, it depends whether there's actually going to be any money for it. But as an idea, I think it's a good idea. We need services in our community and we need things to be returned to Ilford, and that the hospital is an ideal location centre for actually using that facility, instead of seeing it only partially used and then great deal of uncertainty. So that's something that I personally would like to see in Ilford. But yeah, I don't know really what will happen with that, but that's something I would like to see. Anyone else got any further questions?
It was just a point, and also my colleagues had to go because she's got a question. So we represent the University of Greater Manchester, who are actually based here in Petrock, training nurses to bring local workforce back to the area. They've been here about 5 years now. We've over 100 students on our books going through the training courses to try and address that issue of having people from outside the area come and live and work and everything. So my colleague wanted to ask around are there any plans around the expansion of services with all the new housing and everything that's coming into the area?
Do you mean, when you say services, do you mean that infrastructure that comes with the development? Yeah.
Well, I think probably actually you've hit the nail on the head. I think that in the MP's office is probably what we hear every single day is all about, whether it's dentists that Ian and Beth are working incredibly hard on the road network, education, health centres, as you already said. There is no plan, and I think Ian's made quite a strong representation to ministers on that. We've got blanket housing targets to meet. If you ask developers to come, more and more developers are asking to come through Section 106 monies too. And of course, it's being spread so wide. The only money that we can bring in is from Section 106. Invariably, then what happens is you lose the affordable homes, for instance, which is exactly what we don't want to do, because we're going to lose those young people from the communities that will be able to be sort of supporting our elderly residents, and it just goes on and on and on. You know, it's quite clear, you know, yes, we do need more homes, but we need proper funding to support the infrastructure, you know, whether that be through travel as well. I mean, we've talked about that, the bus service at Witherington, and it's chronic when young people can't even get to college to further their education. You know, that, you know, talk about inequality, it's, you know, a number that can afford a taxi, fine. If not, so what happens, they just end up probably dropping out of education, going into work in the, you know, somewhere real local, not really that potential. So, yeah, absolutely. I think you personally, from my point of view, you've hit the nail on the head, and you know, you do need proper funding to top up our infrastructure. You can't, you're not going to get it from developers. Not, you know, get it. That's the only thing you get, but it's just, and you've got the grandfather home there, which means will be even more pull on that money because you have to bring in, you know, obviously quite right, safety of the films, but it's really less money it's given as things that have supported our communities. I don't want to
Can I just respond to the first point? Fantastic, the training you're offering the nurses and the public health nurses who are on health list. The last 2 or 3 years been running at a 15 to 20% vacancy, and we just can't fill the posts. Last week when I talked to our head of health visiting service, Kate, she set it down to less than 5% vacancy now, and actually in North Devon we have a waiting list of health visitors wishing to join the service. So I don't want to be paying a small part of that. You did fantastic, thank you. But it just shows you it can be done, and historically, you know, trying to get people, let's say, to work in North Devon, seen as a they'll come here, we've got a waiting list, and I thought, okay, that's finally exited. Now the waiting list is North Devon. That's it.
This friend was not a question of responsibility there.
Yeah.
Then we got back to Adam and back to Tony.
In our country, we've got 30% of our people living with chronic pain and chronic conditions. Of those, more than a quarter suffer from ill or mental health. And the outreach we've heard this evening has been mostly focused towards the elderly. What can we do to help reach those people that live in rurality with chronic health conditions, mean they can't get down to access these services that are available?
I'll come in again if I just can't find it. That is a really big problem. You said chronic pain first, then changed to chronic condition, but chronic pain is another huge issue that we're seeing more and more of. And with that comes a host of medications that tend to be dependency forming and that for mental health. So there's this huge level of living with chronic conditions, particularly chronic pain, and your mental health getting worse and not being able to or not wanting to engage with health services. So I don't have to go for it's definitely something that's that we would like to work on and we want to do more of. We are, as practices, and I can't speak for all practices at all, but we're certainly looking to invest in more of those areas. So we have our wellbeing teams that we're becoming more targeted with and figuring out how we can do things differently to access those patients and support those patients. We're currently recruiting for a mental health team, which we're really struggling to do. So if you have a mental health nurses, that would be great. And it's about looking at things differently and how we can use that NTT approach as well. So it's not just primary care, as you know, with your GP that you go in and see, it's that whole host of people that now come out of general practice that we're trying to help people support. So I don't have a good answer, but I completely agree that it needs it.
Thank you. We've got time for a couple more quick questions. I'm going to Councillor Bushwell, because he's not asked a question yet.
Hello, yes. I wanted to wait until the end, which is very unlike me. because I wanted to hear whether my opinions sided with the room and with the panel. And I surmise that the direction of travel is in the wrong direction. I think isolation, whether you're in a community or in a rural area, is becoming worse. There have been a number of comments about there are two different councils represented here, but both of those two councils are very likely to disappear, and then we're going to have South Devon likely ruling North Devon in decisions. How do the panel see that having a unitary authority or a change where power moves to Exeter perhaps is going to impact North Devon? Because I get from North Devon people, we've got to fight for North Devon people. We can't fight all the battles, so why don't we start at home? But I don't know what the panel might like to comment about the direction of travel of government, local authorities.
I think it's a really, Councillor Bush, I think it's a really good question. And I think you're in danger of asking the panelists to make a political statement.
Can we explain it?
I think framing your question is there a concern that with democracy moving potentially further away, is that likely to impact on being a better people's voices at home? I think is probably there. And is there any challenges of that when you're delivering services? It's difficult. I mean, maybe that can help.
Well, I think so.
No, I'm sorry.
Well, I mean, I know from our office and from what Ian says in pretty much every meeting he's ever in, we don't want things to be Exeter-centric, we don't want things to be Plymouth-centric, we want to keep everything focused on North Devon. And if moving to a unitary council means that things are less North Devon focused, then it's obviously something that we're not going to support. But I can't predict, nor can anyone here, what's going to happen and what it's going to look like. So beyond that, I can't make too much of a comment.
But then there was asked.
I think that's a really good answer, actually. Thank you. And I think, Matt, I think it's more for us as a council really to be aware of it, make sure whatever comes forward through government reorganisation that community was not.
No, they'll just hammer it through whether we like it or not.
I know it was quite argument, but I just didn't like the practice.
I think it's just shot down our throats, and I think it's going to be bad.
Yeah, no, I disagree.
But I don't know if any of the other members on the panel had an opinion as to whether it's good, bad, or ugly.
I think good value. It's going to happen, isn't it? You know, districts and county will no longer exist. I don't know who my employer is going to be, if I'm going to be employed in 3, 4, 5 years' time. What I would say is, from tackling inequalities, and like the subject tackling inequalities, I think if it enables us to work closer and bring together a team around housing, leisure services, the work which I do as well, there's some positives there. I appreciate your points around where decisions are made, and I think whatever happens, and whatever geographical area we end up being opposed to, we need to have a place-based kind of decision making. We need that place-based, whether it's North Devon or whether it's South Hams, they're just as passionate, I'm sure. We need to make sure we get that balance right. But I think there is some opportunity in terms of, you know, simplifying some of the services we provide, some of the opportunities, and rather than having two separate counties. I think, you know, we're all residents as well, aren't we? As a resident, you know, I want the best for my area, the best for my kids, the best for my father. How you organise yourselves, organise yourself better and work together better. You know, that might be an opportunity. That's the I guess the silver shining in the cloud. How can we do that better? But to your point around ultimately, somebody in Central London is probably going to be giving us what they say going to do.
I think we've got 3 final questions if we're really quick fire. So I think we've got Terry. No? Okay. Councillor Jones and one.
There's Adam and the gentleman over there. But I think it is literally 5 questions, no preamble.
So, Councillor Jones first. One. Yeah, quick ones.
One of the things I've taken from this is that if it doesn't already exist, there needs to be some kind of group that's really working together and bringing things together. Surely that already exists, but if it doesn't, can we facilitate that? And it's for all of you. One quick answer: what can we do? What can this room do to improve the situation in terms of health quality? What can we do?
That one because we've got that. Yeah.
We'll come back to that. If we can ask the two public, members of the public, then we'll come back to
Really
that.
good to put that written down, yes. Ben, sorry, you say good names, you've just gone past one.
Maybe. Thank you. I just wanted to offer a couple of positives from an educational perspective. I work with Hannah at the University of College Manchester. We're really keen to get our nurse students involved. We're trying to put a community outreach ambassador team together so we can work together and get those students out of blood pressure assessment, work with local people that need services, accessibility and so forth. That's one real positive. Really would like to, and there's a lot of project work that they do as well. We'd really like to get involved with this if we can. And also the other positive, just from an educational point of view, was there are tools with Petronics to college emerging. So that might be a positive thing in the future. Thank you.
Thank you.
That's Adam and the red check.
And also maybe we need contacts from people that have got these as well.
My question relates to childcare provision and the driver of inequality. People aren't able to work because there isn't sufficient childcare in school holidays. Example of one of my employees who we had a Southern Holiday Club, and that was stopped, announced about a month ago, and that's a permanent closure because of a staff issue and they can't staff it, and so there is no childcare provision in Southern apart from health clubs. So anybody who doesn't qualify for a health club and doesn't have any childcare, so they can't work, and then they go on to benefits, and then they get chased to not. So I have one person who is on universal credit being chased to work more hours. She can't work more hours because she can't get childcare. Vicious circle. So that then detrimental to mental health.
I think these we're going to capture the questions and reply with a response later, unless the panel member really wants to capture them. So they're in the back.
Gloria.
I'm not quite sure whether I should say anything, but the people who know me know if I've got something to say, I will say it. But I've been listening to little tidbits, deprivation, which Terry is marvellous about Colgate. Bringing in the waiting list down, all these little things I have been listening about, and I've been banging on about for ages. But we, in the room, there's 5 of us that belong to the League of Friends for the Channel Hospital in Wiltshire. And we had a bomb dropped on us this week. I'm sorry, on Friday, we are ordering a protest outside the Channel Hospital. We're hoping, I have already emailed him, and he's very kindly answered. And we want to try and get the North Devon Journal there, but we don't seem to have a lot of luck with that. But we are trying for the BBC or West Country Television, because we're all on about services. We need more services. Well, we are going to lose one of our most vital, not just for us, but from Braunton to Crawley, whether Ilfracombe, Woolacombe, Lee, Westdale, Southmont, Martin, all the way around. We are going to have no minor injuries at all. 7 days a week, we're not having
Gloria, thank you so much for highlighting that. I'm just hurrying you because we're very short of time, but that's sorry. Thank you. I'm finishing up the meeting as quickly as we can, but that's really
well, we're hoping to be able to get something done. Whether it's there or not, I don't know, but I don't think people realise just how it's going to affect the rest of all of them. Because if there is no minor injuries in Ilfracombe, they won't get the medical service because
We want the final question, which Councillor Jones asked, which is.
No.
Okay,
There's a reason why I stopped it. We have to go back into it would have been outside of the public part of the meetings. So I do that just as formalities to apologise to the public because if we don't actually reconvene the meeting, it wouldn't happen be part of the meeting. So I do need now to yes. So I'm now moved to reconvene standing orders. Just picking up, Gloria, your passion comes across it, and it's not gone next to me. I don't know how many people will testify. But I'm guessing, because I know Alison Stevenson is on call for Devon Live, so I'm guessing Alison's listening to this, and just for Alison's information, put your hands up if you're from Ilfracombe. So you know, it's 50%. It's a 50% of the people that are here, and they're the furthest from where we are. So it just shows the level of hope, the need of help really. Those real criminals. But Alison is on the call, Gloria, so hopefully she's heard you and heard Ilfracomb's voice. So we've reconvened. Councillor Jones, can we go to you? Because I think you were.
Yeah, we go, John, now. I'm happy to.
So it was moved by Councillor Jones, seconded by Councillor Ward. All in favour? Do apologise. So over to you.
I think you were best in saying, quick fire round. A quick fire round, so an answer each. What can we? What? Is that the question or not?
No. It's only one you make a recommendation. Sorry. No, we can't go back into questions. Well, come on, you've answered nothing. It's been really good. Huge question.
I think we wanted a quick fire round. Well, the whole point of being here is we've had several revision elements. It's about actually getting something done. So what can we do? What should we do? A quick fire round from all of you, really help. Thank you.
I'm sorry, it's not an easy answer, but the voluntary sector does a huge amount with very little, but we're not getting very little. So it is funding.
From farmers' point of view, is try and promote what pharmacies do, what members need, again, but it always comes back. Okay. I'm sorry.
We're not saying funding. What can we do? I mean, there's a lot of good work happening. My point of view is why can't we sustain it? Why can't we take it forward? So I'll be curious to know how I can help. I haven't got lots of money, but how I can help to take things forward. We have one Ilfracombe, one Northern Devon. There's lots of partnerships around for many years. So sorry, short answer is funding. Long answer is how can we help?
I would say that as for North Devon Council, helping with targeted recruitment and workforce campaign to just promote North Devon as a brilliant place to live and work for younger people who we struggle to get to come down here.
Funding is very tempting to say, but it is what we all need. I would say though that from this, meetings like this are great, but they often end at the minute and then it gets done. So it's actually taking something away from this and doing, and we can meet again and we can have, there is one Devon, we've given those forums, but we need to be working together more. And then again, looking at transport, housing, especially for children, education, it's a whole host of things that need to go into that preventative piece.
John wanted to come back.
Yeah, thank you, Chair. Yeah, my name is John Biggs. I'm the Council Director of Resources. Funding is obviously mentioned a few times. Obviously, funding for all councils has obviously reduced over the years. There is a fair funding review currently out for consultation by the government, so we are lobbying government for deprivation and rural services and higher costs of providing those services in this area. So we are pushing for a fair funding for North Devon. We hope our colleagues at other councils in the area are doing the same as well. So I know the county councils will be try and get a bigger cut of that payment so that we can continue to provide services. Those services are increasing in terms of demand. colleagues at the Freedom Centre. It's fantastic in terms of that multi-agency approach, trying to get more funding to go into those multi-agency approaches so that they can continue into the future as well, not just for 1 year funding, so that we've got some longevity as well. The other thing we're doing is pushing for recruitment as well. Obviously, we're advertising lots of different places now than we did before, so we're trying to attract and make North Devon the place to be to come and work. So we continue to push that into lots of other areas. And the other thing that we haven't really touched on too much tonight is housing. Healthy housing is one of the council's big projects at the moment. We've invested £2 million currently into Ilfracombe. We're acquiring some units of accommodation. We've bought the old Royal Mail building in High Street, which we're going to then put some units of residential on the upper floors. And the aim of that is to provide social housing so that we can provide more affordable housing in North Devon. And the aim of that project will be to create 15 units of housing in Ilfracombe. The social housing rent we get from that we will recycle to then buy the next batch of social housing as well. So trying to intervene in the market where we've got derelict buildings, the housing units to make bigger units so they're better in terms of healthy outcomes. So the aim really from the council perspective is to try and invest more money to intervene in housing, because housing is obviously an integral part to everything that's been talked about as well. One final point is around the work at Freedom Centre. Obviously, we've got vulnerable customers out there. One thing we're also trying to intervene is temporary accommodation. We don't want to be putting people into bed and breakfast accommodation. That's not great for their health and well-being. So one thing we are trying to do is find more units of accommodation that we put people into permanent accommodation, which is better in terms of not only cost for the council, but more importantly, better for health outcomes for the people and our clients basically in there. So we are pushing for a fair funding for North Devon, and we'll continue to do that alongside our colleagues at the council and other councils in the areas.
You and everybody, I just wanted to also just sort of pull in a few of my thoughts. Reading the pack actually that comes with the agenda, I was just, I know a bit about health inequalities, but reading it all is very powerful. And one of my thoughts is that actually that piece should perhaps be available and presented and stand alone in some way for other councils to read in North Devon Council and maybe further afield, because what I think it was you, Steve, saying that whenever we make a decision or plans, we should be considering how it's affecting health inequalities and if it can make them better or worse. And without having this front and centre of our minds as councillors, we aren't necessarily going to be doing that, because things inevitably sometimes when we're faced with new priorities. So I would personally love to see that information somehow captured and circulated in another way that makes it remain, rather than being a minute or an agenda pack that then goes into the past. And what you were saying, Sabrina, about further and deeper collaboration, I think that's really important. I don't know how as a council we can help with that. We don't want to create additional networks where there's already lots of networks, but I think it's really amazing and powerful that we've come together and talked about this, and how can we, what are the ways in which we as a council can help with communication and coordination of things that are going on, services like the pharmacy services. How can we simply help with communicating what's going on in our communities better? So there's just a few of my thoughts. But thank you.
Thank you, Sarah. I must start by thanking you. So I'm a bit of a Don Van Lake to this committee. So this was all set up before I was asked to chair it, well, vice chair actually. Yeah, so I think time to think of a colleague in this sphere who, I think she was involved in bringing this forward and is not well enough to be with us at the moment. So I think it's time time like this when we think of Liz and all those different people in our communities that do suffer, and I think that's where most importantly we as community leaders and councillors in our communities is a little thing on the post. I think those of us that are here need to badge the rest of the councillors on the importance of making sure that we're connected with the communities around inequalities, and it's not always the loudest voice that we should hear. We can dig below that and make sure we're finding out what the challenges are. And I think for me, that talking about how we break down those barriers, and I mean, there's a lot of wonderful work that's going on in lots of areas. I mean, I think of mental health, when Jennifer here talks about mental health, you know, I'm there thinking there's so many different bits going on. How do we bring all that together and make sure that it's focused? So, you know, whether it be the farming community or getting support, young people, elderly people, you know, but, you know, not all running around in circles and duplicating work. It's actually a bit of a focus. And I think that's where, for me, we need to challenge ourselves system. And that's where we as councillors can probably know what's going on in each community to bring it into one place to then make sure what little resource we've got, because at the end of the day we keep shouting funding and we keep shouting. But 15, 16 years under different governments, all we've seen is going down, and you know the reliance on volunteers going up, and they're getting older as well. So that's the other part, and it's recruiting the next group of volunteers and making sure they're valued. I was personally from a volunteer myself. Yeah, I've had to jack a couple of my roles in certain things. Obviously, it's followed him. Putting together a simple community event used to be easy. Now the police want to have a piece of it, the county council, the highways department can be a complete nightmare. In the end, people just walk away from putting on events. And you know, I think the best health thing we can do is have fun, isn't it? The most important is the community smiling and happy. That will, and it brings people together. So, you know, personally, I like some bureaucracy around, you know, volunteering. Reduce and get that like some of the councils can do, as opposed to, you know, volunteer just wants to turn up at a mountain on Monday morning, jump in a car and get that patient to the hospital and feel good about it that they've made that difference. And former councillor Edwards is not, and the nurse is not spending 12 or 14 hours on a day out to Plymouth, you know, and I've seen that, I mean, obviously Councillor Edwards' carer was couldn't help but think about the nurse that we all day and whether he or she had been fed and looked after, and you know, she's still working in the NHS, or scientists, whether they're working in sensory schools. So I'm rambling on, but I think please nobody leave this room without even leaving your contact details, especially if you've contributed. So it's very important. There's some really good, you know, evidence given, and there's some real good ideas and passion in the room. It's going to be important that they go forward. We reconnect with you to really drill down. Perhaps one of the actions is that, you know, I'm sure council also to lead up some sort of task and finish it. Really looks at this and commits to what we're actually going to do, because we mustn't, as you say, just as become a 7 minutes that's forgotten. I'll finish by thanking our panelists. Absolutely brilliant. Like we said earlier, I mean, sometimes we can, and I thank the public for it, because sometimes we have a public meeting like this, and poor panelists will tell them, you know, shoot the message type stuff. I think it, you know, it really is, you know, really grateful that you've made the effort to come here tonight, and thank you for the difference you're making and everybody in this audience. And yes, you know, not one of those who come up from Austria St Mary, you know, it's important, like you say, linking what John said it, Steve said it, it's really important that both councils are working together to understand the issues. We appreciate it. Thank you all. Before we close the meeting, we will be, if you leave contact details, we will make sure that we communicate with you all what the actions tonight are. Thank you.